there's no question that the mainstay of modern pain medicine is self-management. We can help patients directly sometimes to a degree with medications or injections, but often, and for most patients, that's only a part of their solution. And for those patients who do best, a big part of their the benefit that they get is learning to self-manage better. I see a lot of the different techniques and interventions we use within the clinic as being complementary in that regard. So the overall goal really is to help people self-manage and live their lives better.
I think it's important to see self-management as a process that people go through. You have to learn lots of skills in order to be able to do that, but also develop a confidence in being able to do that. And one of the things we notice is that people sometimes ebb and flow with that, so they go through periods where they feel they're managing that well, and other periods where they might need to come back and look at some of those things again. And it might not be through psychology, it might be through other parts of the pain. So
one of the things we really want to get across to people, I think in general practice as much as possible, is that it's as much really down to them as it is down to us. So self-management is really the key, and we want people to manage their condition. And I think now, because persistent pain is being seen much more as a chronic condition in its own right, so similar to diabetes, chronic lung conditions, chronic heart conditions, that actually when people start managing those chronic conditions themselves, taking responsibility for their diabetes and their heart disease and their lung disease, looking after their medications, making sure that they're taking them appropriately, making sure they're undertaking activities which keep them generally fit and healthy, eating the right kind of foods, doing the right type of exercise, that's really important. And equally, that kind of thing is important for people with persistent pain as well. So when someone with persistent pain gets a flare-up of their symptoms, they've got a toolkit of things that they can reach into themselves to get them through that bit. So rather than thinking, well, I've got to see the doctor, or I've got to try and get an appointment to see the specialist, actually they've got stuff that they know works, okay, because they've got a good experience of it. And then they can use those, get them through the bad patch, because they know there was a good patch coming around the corner, and they've got to get through this flare-up. So if we can make sure patients are equipped to deal with those flare-ups, so they expect them, but they also know how to manage them, then it would mean that they're able to do more themselves, and I think ultimately that's what patients want.